Hi, my name's Kim and I'm a lecturer in occupational therapy in the School of Allied Health Science and Practice. The reason I chose to be an occupational therapist was because I didn't want a job where I was sitting at a desk doing the same thing day in, day out. I wanted a career that was exciting and diverse, and I, more than anything, wanted a career where I could help others and really feel like I was making a difference in their lives. Occupational therapy provides just that. Occupational therapists are interested in supporting people to build up their participation in activities of everyday life. This may be working, taking part in education, parenting, socialising, or simply just looking after themselves. It uses a whole person approach to health and well-being. So it's not just about the physical activities, it's also interested in the psychosocial, in the environmental aspects. I used occupational therapy to take me down a career path where I worked within community, aged and disability care, and also within adult rehabilitation. So specifically working with people who had sustained burn injury, amputations, or orthopedic injury. OT is so diverse though, and your career may take you down a completely different path. You, for example, might help children develop fine motor skills so that they can learn how to write. Or you might help elderly people with strategies to manage their ailments so that they continue to live at home for as long as possible. Or you might assist someone recovering from workplace trauma to return to their vocations or other leisure pursuits. Whatever trajectory you go on, you will transform lives by being an occupational therapist. You'll graduate with fantastic career opportunities, ready to help children and adults live lives to the fullest, and also support entire communities restore meaning and purpose. Talented occupational therapists are already highly sought after, and with a 17.1% industry growth predicted by 2025, demand is growing fast. In 2020, over 94% of recent graduates in rehab areas found work after graduation. Occupational therapy is a fascinating career. You get to work with people of all ages from a broad variety of cultures. And as an occupational therapist, no 2 days are the same. It could also be your chance to travel. Your qualifications will be recognised around Australia, with much of Australia's predicted industry growth occurring in regional areas. You'll also have the opportunity to register in numbers of countries around the world. There are a wide variety of areas of work, from mental health, public health, paediatrics, acute care, community care, ambulatory care. Whether you find a job in public or private hospitals, rehabilitation settings, schools, or in research or policy development, you are sure to develop a rewarding career. Studying OT at the University of Adelaide connects you to a world-class education with a prestigious history. We are South Australia's most comprehensive and globally recognised health education environment. And in 2021, we proudly launched our degrees in Allied Health. The Bachelor of Occupational Therapy is a 4 years honours degree. It has a strong focus on tutorials, workshops, and practical skills. And it uses simulated learning experiences to really develop your clinical skills. You will have the opportunity to work alongside other allied health students, preparing you for the collaborative nature of real-world employment. And our small class sizes mean that you develop connections with lecturers and tutors, as well as your classmates. In your third year, you'll choose from one of 2 streams, research or industry, and you'll undertake a major project. The industry stream focuses on integrating research into practice, while those in the research stream may have the chance to impact policy and practice. Our allied health students learn in fantastic facilities. Our Ray Last laboratories are home to the statewide body donation program. This is where students have the unique privilege of examining real human anatomy and specimens. It allows you to translate the information received in textbooks, lectures, tutorials, and digital technologies into the real-life environment. We also have brand new, purpose-built training facilities. Our immersion room allows students to witness medical procedures or scenarios in life-size environment, with a 360-degree videos and images that can be projected on surrounding walls. And coming up is a new occupational therapy hub with student learning kitchens, bathrooms, and sensory spaces. Industry placements are a key part of our degree. Over 1,000 hours of work-based training will give you the skills you need to be able to practice and implement evidence-based practice. On placements, you'll work with children and adults of all ages in a range of public and private health organisations, community, education, rehabilitation, aged care, and more, ensuring that you're job ready when you graduate. You will receive the very best teaching from our highly skilled and passionate lecturers and tutors, and you will explore population health issues and population approaches to improve the health and well-being of the community. There is also a focus on cultural diversity, particularly on Aboriginal and Torres Strait Islander people and communities, as well as regional and international health. A lot of people ask, where could I work when I graduate? You could work in hospitals, community centres, schools, day therapy centres, in people's homes, or a number of other settings, with the opportunity to work interstate or internationally. So what subjects would be useful to study in Year 12? While there are no prerequisite subjects for OT, it would be advantageous to take biology and psychology, so you have a bit of a background when you start your degree. As you've heard, OT at the University of Adelaide is such a wonderful degree. I really look forward to hopefully seeing you on campus in future.